Welcome back to Beauty Times Medicine, the video series hosted by Galderma, where we continue to uncover the science behind beautiful, healthy skin. Joining us today on Beauty Times Medicine is Dr. Jeff Huang, a board-certified dermatologist and internal medicine physician based in Taipei. As director of L'Excellence Aesthetic Clinic, Dr. Huang has built an international reputation and frequently shares his knowledge around the world. He brings a unique perspective on a wide range of cutting-edge treatments. Dr. Huang, we're excited to have you with us. Welcome.
Thank you, Doctor.
You have a very impressive career, but let's start a little bit with your journey. Was it like a light bulb moment that made you say, oh, I have to go into dermatology and aesthetic medicine? Or what triggered that?
It became clear to me pretty early at my school age that I have this crafty hands and a very good taste for beauty. But of course, I didn't consider to become an artist because, my parents would tell me you can't make any money out of it. It would be starving. So when I graduate, as you mentioned, I started as a physician of internal medicine when I graduated from the medical school. But then I was ready to enter the cardiology or enterology because...
Oh, wow.
Yes.
So not aesthetic medicine, but...
No, because, internal medicine. Because these are the two subspecialties when you have the most procedures to perform with my hands rather than just prescribe medications. And then one day I bumped into a elderly relative of mine who just received HA injection. And sadly, the result wasn't very good. That was a very early stage when injectables just entered Taiwan market. And then it occurred to me, well, this is something I'm going to be good at because it's a good combination of science and art. So I redid the residency in dermatology and focused on aesthetic medicine, and I love it.
So if you look at the patients that you're seeing now, what are they looking for? Are they looking for an enhancement, or they want to conquer age, or what do they want to do? What are you seeing in your patients today?
Taiwan is unique in its culture of diversity. So we are the first country to legalize same-sex marriage in Asia. So I would say people are relatively open to express themselves. So with the rising economy and advancement of aesthetic technology, there are trends in Taiwan that's pretty similar with the trends occurring worldwide. For example, non-invasive procedures replacing invasive ones, or the age of receiving cosmetic treatments getting younger, or the male populations getting more. So there are some trends that you don't really see often in the Western countries. And these trends are often fleeting and short duration. But the demography of most of my patients are like middle-aged women who don't really want that much enhancement, but mostly about slow aging.
Okay. So they say, oh, I'm seeing the first signs of aging, so I want to intervene. Or what are they saying?
I start to see more wrinkles and folds on my face, and I want to do something proactively to fight against it.
But if anyone thinks about Taiwan, it's about technology, advancement, cutting edge. So what about technology into aesthetic treatments? Is that something that influences the way you think about it? Are you using a lot of instruments, or how are you thinking about technology and aesthetics?
So first of all, if there is something new coming to Taiwan market, most of my patients would be really eager to try them. But on the other hand, the regulations in Taiwan is relatively strict. So it's more or less difficult for us to have the most cutting-edge technology. But I'm looking forward to, now AI is everywhere, so I'm looking forward to more AI incorporated in the...
So you use both injections and you also use energy devices?
Yes,
or
both, yes.
And how do you decide whether you're going to go with injectable aesthetics or you're going to go with energy devices, or do they coexist in your treatments?
Very much, yeah. I spend lots of time talking to my patients about their treatment goals, and I use a holistic approach before I make up my treatment plan. So Most of the time, I do, yes, both energy-based devices and injectables. So I give them a plan ahead. We do this first, but then in 1 year of time, you're going to need something else, and you're going to do this like annually. So I give them this picture so that they know what their plan looks like.
And most of the patients you treat, are they your regular patients, or do they just come by, or how does that work?
I do have more regular patients than the new ones, because my regular patients, they bring their friends.
Okay, so it's word of mouth.
Word of mouth mostly.
And when you have patients you've had for a period of time, do you also follow them? You get satisfaction from treating them over a longer period of time, or how does that work?
Yes, so we have this department of functional medicine in my department as well. So it's not just about the aesthetics. I talk to them partly to know what their lifestyle is like. You have to take care of your internal health before you do this cosmetic treatment.
So cosmetic treatment is kind of a more holistic.
Yes.
It's not only getting injections or energy devices.
Yes.
You also need to
Yes.
make sure you're otherwise.
I always tell them that exercise is the priority.
And are there any specific trends that you're seeing in Taiwan in terms of what people are looking for? Do other people come with pictures and say, hey, this is my favorite star, I want to look like that? Or
They do. Yes, the Korean beauty influencers has great influence in Taiwan as well. So yes, they do bring photos of the stars
that they want to look like.
that they want to look.
How do you deal with that? Do you say, well, maybe I don't recommend this, or how do you deal with that?
Exactly. I don't always say yes to what they ask. I would say, well, maybe this doesn't really look that good on your face, because after all, it has to do with the proportion of the face. There are patients who are very obsessive and they just want their procedures done. So perhaps these patients will go to other doctors. But if they are my old patients who trust me, they will trust my advice.
And you said at the beginning you really wanted to go into a field where you could use your hands and really exercise. Do you feel now fulfilled?
Yes, I'm doing injections at pretty similar parts of the face every day, but like every patient is different. The biggest achievement comes from the satisfaction, the feedback after the treatment that they give me. So yes, I think I'm pretty good at what I'm doing now.
What's the thing that you find is really driving aesthetic medicine today?
People are more and more openly talking about this. They are willing to share with their friends. Actually, there is this movie ceremony that just took place, and on the stage, an actress just openly talked about the device that she received.
It also encouraged maybe your patients to talk about the treatments they have.
Yes.
Wow, very interesting. Well, it's been a fantastic to talk to you. I must say I learned so much. I think Taiwan is cutting edge in so many ways. So thank you so much for sharing all of your insights. It was a real pleasure. Thank you for joining us on Beauty Times Medicine. We hope you're enjoying this series, and we're excited to bring you more expert insights and leading voices from the world of dermatology. Stay tuned as we uncover new insights for every skin story.